Hello, everyone, and welcome to another episode of Healing Conversations. My name is Einav Avni. I'm an energy healer and an alignment coach. And this podcast is all about bringing the message of alternative, natural healing to chronic pain, chronic illness, and unexplained medical conditions. Before I won't keep you long. Let's get started. And with me today is the wonderful Dr. Tovah Goldfine. Dr. Tovah, welcome to the podcast.
Well, I am so happy to be on this end of a podcast because I have a YouTube, a weekly Facebook Live, and it feels really wonderful to be in this position. And I feel really blessed that we met and that we're in this healing world together, really healing ourselves, I always say, and our clients, and helping them find the doctor within.
Indeed, indeed. And you have so many. I mean, I was reading your bio, I was sharing your bio, and I want you to tell us a little bit more about you so that we are all on the same page. Where did you start from? What are you doing now? A little bit about the round table, of course.
Well, I love the word alignment because I am a chiropractor, and I was never your run-of-the-mill chiropractor. I remember reading, even like in the beginning of chiropractic school, the book Anatomy of an Illness about Norman Cousins, healing, through laughter, and I knew something was going on. Look, I grew up, and when I was 11, my mother got multiple sclerosis. So it's almost like the trajectory of my life was changing, and I was trying to just stay on in alignment. And I dropped out of college, came to Israel, lived in kibbutz, worked many jobs, and then got this job as a chiropractic assistant. And so, wow, this, because chiropractic is very philosophical. They talk about this innate intelligence. What's making your heart beat? What's making your stomach digest? This is autonomic nervous system. Well, okay, but what's keeping that done? Like, well, it's my nervous system. Well, what's keeping your nervous system? Like, is it a plug? You plug it in? Well, it's connected to some kind of universal intelligence. And so it was very spiritual. When you think about it, and chiropractic, I mean, it's a degree. I'm a doctor. It's a doctorate degree. I dissect a cadaver. I do an intern for 2 years. I have to take tests. I pay a lot of money for malpractice insurance, but actually my malpractice insurance is less than any other medical doctor, because I don't use medicine or do surgery, and I don't invade the body. And it's a wonderful profession. And the majority of chiropractors are, I have to say, wonderful, sensitive people. And, it's something you need to understand. People sometimes are scared of us, but I like to say that I'm a gentle chiropractor. I do a lot of preparation before doing any kind of movement. And by the way, that cracking sound is not a word that I even use. It's a bubble popping. It's fluids in the joint. So chiropractors gently manipulate joints. And the body, we all know, is made for movement. That's why there's a spine and joints and tendons and ligaments. We are made for movement. And when something gets stuck, I'm okay with an Advil, but I also want to kind of see how it's going to move. And then it'll move. The Advil will work better if you get the body moving. So that led me down a path of understanding much more, wanting to get to the cause. And sure, for years, maybe we thought, well, the cause was a disc, or the cause was a bone out of place. And then I said, okay, this is good. We got the cause of a problem. And then after a while, chronic pain was coming into my office. And I thought, well, I don't think they need 20 adjustments. I mean, the problem happened a year ago. And if it's an acute problem, you need 6 adjustments, and you need to get into the water. You need to go walking. You need to be aware of your posture. This all became something. And all that time, there was, of course, this awareness about my mom and why she got MS and why this, and questions. And so it led me down a path about 15 years ago to want to go deeper and understand it. And I fell into Dr. John Sarno work, which he was the pioneer, and he died at 96. But then there were many doctors that took his work and took it to the next level. They studied it. They researched it. They found enormous resources. They understood why we say repressed emotions cause symptoms. It almost sounds new age, but there's a very scientific thing happening. I mean, pain is an emotion, which is another whole broadcast. So I got very involved 15 years ago in the Sarno work, and was lucky to meet Michael Galinsky, who made the movie All the Rage and starred in it. He came to Israel. We showed the movie. We did a lecture at the Cinematheque. There was there's Dr. Nir Brosh. She was also an Israeli, was very involved. And I saw myself shifting, in many ways. And then it just snowballed into the most amazing part of my career that I feel like it's a mission. So I love adjusting spines, and I have a wonderful table, and I'm very gentle, but I won't let people believe that their chronic pain is going to get better from an adjustment, because there's something deeper going on. What do
I
you
love
think?
that.
What do you think about
I
that?
absolutely love it. Yeah, there is a quote that I really like from someone called Deb Shapiro, and she says, if you believe that your body is a machine, you will try and fix it with surgery, and if you believe that your body is energy, you will fix it by understanding the emotions that are blocking it and trapped in it and causing
I
all.
think I saw that on your site. It's a beautiful. I don't know who Debbie Shapiro is, but it's beautiful.
Yeah, yeah,
It's beautiful, and and if it's a very deep spiritual conversation about why the brain, because I didn't learn this in school, that the brain is a piece of flesh. The brain is an organ. It's not something that runs our life, that controls us. We control it. We're the pilot.
right. But that's next level, right? That's the thing that we were brought up on the idea that you can't change your brain, that your IQ is set in stone, and that that it's all static and that's it. And here we are saying, actually, no,
Yeah,
it's
and
completely
then
dynamic.
we shift way back to another field, which is like the 12 steps. Is, well, you can accept it or change it. And
Mm.
actually, when you accept it, like you can accept it the way it is. But if you want to change it, you have to accept it first. So it's brilliant. It's brilliant, because the movie All the Rage, which I highly recommend, it's for $5. It's an amazing movie. They wanted to call it all the acceptance, but all the acceptance wasn't going to sell in the box office, because if you
Mm.
accept your anger and you accept your fear, it has much less charge, and it's just energy, fear and anger.
Mm.
And there's a possibility to be healthy with your emotions. All right, doc, that's new age. What do you mean emotions and my health? And then, like, I'm thinking too, like, this is new agey, but pain is an emotion. It's processed in the same place as the amygdala,
Mm.
which can, I'm not going to get into that here, but and the brain perceives threat, 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 and the brain behaves like it's supposed to, protecting you. And this is the neuroplasticity, which is part of my work. And I mean, just mind blowing. And I just wish, and guess what? All the doctors know about this. We all know about the phantom leg. We all know about, the Skinner's behavior modification. We all understand. And even Dr. Schieberner will say, he's one of the doctors that worked with Dr. Sarno, and he wrote a book called Unlearn Your Pain or Unlearn Your Anxiety. He'll even say in school he got like an hour on pain management. So I'm not here to blame doctors or bash doctors.
Mm.
They didn't learn this. They learned to fix the body.
Yeah.
And and I know that the doctors came from a place centuries ago where they would go in the backyard and take out an herb and put it in tea and heal you. And that was called valerian root.
Mm.
We've come a long way from the herb garden.
Yeah. But one thing that so I just want to kind of
It helped me focus.
yeah. Well, Dr. Sano was the first, or as you said, a pioneer, understanding that really people that came to him, and even if he himself saw that they had this problem or whatever that could explain the pain, he was curious about understanding that actually some people with the same kind of exhibits didn't suffer the pain, and then he started asking the question and saying, "Well, hang on, there's got to be something more than that." And so now, of course, we are saying TMS, the mind body symptom, or
Yeah,
the,
yeah,
really, we don't necessarily go straight into the body and the structure. We really want to understand the emotions and the stress and all these
right.
things that are happening in the background.
Beautiful. So I'm going to interrupt you because I want to give some tools and tips, because it's not
Yeah,
just, there's the knowledge, and we can get knowledge on the internet. We can go anywhere and become the smartest person in the world, but if we're not applying it, then we're stuck.
yeah,
And so it's a very good point that you brought up, because once we understand our relationship with pain, then we can help to heal ourselves. And I want to tell a quick story. It's anyone can text me or PM me, private message me. I'm on Dr. Tovah Goldfine or TMS Roundtable. You can find me anywhere. You can WhatsApp me. I have even like a free WhatsApp group. It's a silent group where I post things weekly. Like, I really want people to become educated, because they really can heal themselves. And of course, I want to help if I can. It is my parnasa, but there's so much that we can do to prepare. And then, so I want to say something so fascinating, and I'll send you this article if anybody wants it. It's called The Tale of Two Nails by Dr. Rachel Softness, Coff, another pain doctor. And it tells two true stories about two different people and how they deal with pain. And part of it is how we grew up, what our conditioning was. My
mm,
mother didn't even have a thermometer in the house. So that's how I dealt with pain. Like, who cares? Like, you don't need that. And I almost destroyed my daughters because I didn't give them attention when they were sick, because, how the patterns, So
mm,
we all have ways that we deal with pain, our experience, forget even past lives, but we have a relationship with pain, disease, symptoms, something happened, an accident. This is part of how we help someone, and how I
mhm,
want someone to understand how they got to the symptom. So it's this true story. There's a British guy in a construction site, and he gets a nail in his boot. And he's freaking out. He is freaking out, screaming. Like, you cannot calm him down. His fellow workers go to the first aid kit. They try to, wrap something, inject him with something. Nothing works. They call the ambulance. They stick a needle in his foot. Nothing. He's screaming, freaking out. They get to the hospital. They cut off the boot. The nail was between the toes. This is his experience of pain, which is, I see this and I am reacting
mm,
so much to this pain that my brain is creating enormous. Okay. Another guy on another construction site, it's a true story, shooting nails in a plank, and he gets a little something in his face. 2 weeks later, he's at the dentist with a toothache, and there's a nail piercing his brain. He feels nothing. Okay. So look, we all just got out of COVID. Who wouldn't have health anxiety?
mm,
We have, each of us have a relationship with our body, which is this temple. I call it a temple, or this house. And we have how we feel, how we see ourselves, how we look. And there's a relationship. And when it's healthy, and somebody doesn't have chronic pain or medically unexplained symptoms or stress illness, which is another name, or mind body symptoms. So part of it is to understand yourself. When people come to, I think, us to heal, we kind of want them to see that this is some kind of mirror. What can you learn? You're not a victim. What can you learn? You're coming out of this on landing on 2 feet. So how can we see something beneficial in this? And that's an old, Torah concept about finding the gift.
yeah,
Nothing's new under the sun. It's all from, our ancestors, but finding the gift. And sometimes we're not ready, but there is a will and a purpose. And the most people that have healed, I have a YouTube channel with 200 broadcasts in English and another 100 plus in Hebrew, with people healing everything from cancer to MS, even to arthritis, to ankylosing spondylitis, to IBS, to chronic headaches, to migraines. And I always say, these are not Dalai Lama people on the mountain. This is you and I sitting and making a decision.
yeah.
So some of the, just lost my train of thought. Anyway, so some of the tools and insights that I want you to know that you can do, and what coaches like you and I, do, we support, we help people understand the need for consistency, that it's a habit, that your brain has learned the pain, the brain has learned the trauma, the brain has learned the anxiety. It's almost like it's something we think we're not in control of, but we are. So part of it is knowing yourself. That's number one.
Yeah,
Number two, yeah, what would you agree with that, with your work?
absolutely. I think it kind of comes to me that a lot of the time people would go to the doctors and get diagnosed, and when they have the label of the diagnosis, whatever they were diagnosed with, they will carry that, and now they stand behind it, and now the whole world shifts to kind of align itself behind this diagnosis, and it takes, I guess it's part of the journey, or to decide for themselves that actually I'm not allowing that to dictate my next step. I actually want to, well, the doctors may not know what it is, or they might not know how to fix it, or whatever they are telling them, but I'm not letting that decide my future. And so it's such a big journey now to say, now that we are saying actually it's the mind body condition, mind body symptom, for people to understand that actually it's the mind that is in charge, and it's really not the body that is
Yeah,
giving them the pain. It's the message behind it, it's the emotions behind it, it's a whole waft of things that have happened that kind of led them to where they are today. It's a big learning curve, I guess,
100%,
for some people,
100%.
but
And I
definitely
think
a
you and
very
I, I
important.
think you and I are in agreement that
Yeah,
we're not here. The medical system works for certain conditions, and they're medically explained. But there are so many that are not explained, and people are on their yashvan, which is buttocks in Hebrew, on
mhm,
their ass. And you and I don't want people to lose hope, because the body created the condition, and the body can heal it. The body has the solution before the problem. So again, I'm not against chemo, I'm not against medication, but if you're not getting better, then you're sitting in the office of Einav or mine, and then we want to help you, but we're not. We want to integrate. Which we have a friend, Dr. Naida Alexander, who's an integrative doctor and a researcher, because she saw the need to do both. And I'm all about that. Being a chiropractor,
mhm.
I'm gonna help you go and get medicine if that's what you need. I'm gonna send you to the dentist. I'm gonna send you to get your jaw wired, whatever you need. But there's always a psychological component. And
Yeah,
what we're saying is sometimes it's a bigger, and it's running the show.
yeah, absolutely. It's really interesting, this conversation, and I know that we're taking a little detour from the steps that you were mentioning, but I think it's one of the most fascinating conversation to have with someone, or that someone can have with themselves, when they finally understand, or allow themselves to understand their emotions, and in which way they were blocking them, or not even acknowledging that there was anything going on. Um, yes, maybe I'll keep that question to afterwards when it's
Yeah,
yeah.
and part of the tale of the two nails was to we so Norman Cousins was not a doctor, but he also wrote a book. He wrote a book on anatomy of an illness, because he had a terrible arthritic disease that he got after a stressful trip to Russia. And he thought, well, if my body made this disease, my body can. Like, he started to think about it. And then he
Mhm.
wrote a book called Biology of Belief, because he started to interview doctors. And when doctor says, there's nothing I can do, you go home and you die. The
Yeah,
doctors say, well, let's think about this. Okay, let's think, like, see, this is a whole different relationship, and we are now finding more and more of us that are saying, no, no, you can heal this. And even if you can just be in recovery, I mean, I've met people with MS that are in recovery. They may still have plaques on their brain, plaques on the myelin sheath,
mhm.
but they're not reacting to the symptoms. So you see, it's a rabbit hole or a complicated situation. And I think what we're saying here is, let's have the patient be in control, responsible, interactive, integrative, participating, saying, doctor, I want your attention and your help. And there are doctors that are willing to do that. So that's where you have to come into the world that Einav and I live in, because there's hundreds of doctors that we know, and therapists and scientists and movie directors that are collaborating with the medical model. This is not black or white. The human body is a piece of art. Tell me, Einav, how do you scientifically study the human body?
Well, exactly. Because when you do that, it's just partial, right? It's you're completely missing out on quite a lot of, you know, facets that we don't see with the scientific mind.
Yeah, exactly. So I think number one, if I left you with anything, it's that the medical model does look at, taking care of the symptoms. That's what they're taught. But our model and the allopathic, or there's other names they call it, the integrative, the mind body, is looking at the cause. I want to get rid of your symptom. I'm the first to give you some Advil, or I pull out of my pocket for some patients. It might be expired, but and I'm the first to ice pack and a brace and a Nordic and a walking stick. I'm the first to get you moving with whatever tools I can.
Mm.
And if you need some medical marijuana, or you need some opioids, first I'll say that when you breathe and you exhale, first you create a whole pharmacy inside just with your breath. But I'm not. See, so I think it's important to put that out there, that I feel really good about where I'm at and where I've come from. And, it's been 40 years, and I kind of, wish I knew now what I knew then, but this is my journey. And so, so understanding the medical model, not letting the doctor be God, being open to other branches. It is science that the mind affects the body. It is science that there's a placebo. When I think this pill's going to work, or this treatment's going to work, or this therapist's going to help me, it's a sure bet. So it's understanding energy, and this is a whole nother. When I interview you, I'm going to interview Einav in a few weeks on my podcast, and you're going to do the talking about your amazing work. So I want to give a few tools and tips. Do we have some time left?
Yeah, absolutely.
Okay, because as I said, look, we could talk all the time about the knowledge and how amazing and all the people that are healing. But you know what? We're sitting here and we're in pain. We have a medically unexplained symptom that doctors can't figure out, and they put us down a rabbit hole, and then this pill for this and this pill for this. And we're suffering. And I'm saying, don't blame the doctor. He's doing what he's supposed to do. There's always an opportunity to heal. It's always a way out. Okay. And belief and hope are chemical. Just like fear is chemical, just like love is chemical. So belief, your body understands when you have a belief and a will, your chemicals change. So part of how I teach people is to do certain somatic methods of healing, which is partly, I think, your work. Also, some of it's journaling. There's lots of research about expressive writing, that when you write your thoughts, your neurology changes. Your nervous system fires differently. Your neural circuits are different. And this has been studied, and it blows my mind. And yes, it's not easy to journal. Why? Because I have to visit myself. I have to sit with myself, and I'm with myself all day. Enough. Boring. But this is an unbelievable tool. And there's doctors that swear by it. Dr. Hanscom, who's a spinal deformity surgeon, he says to write your feelings or write your thoughts, whatever, and rip it up. Okay. And then there's journals. There's Dr. Schechter has a journal, a 30-day journal. So there are ways to make it easier, but journaling And let me say something about something isn't comfortable. There's something called reaching into the resistance. Sometimes when we're resisting something, it's the exact thing we need. And that's between you and your resistance.
Mm.
What do you think about that?
I sometimes ask my clients to write, and I say, but I have to just one thing that I want to say to them, and that is, I want you to not don't justify the people's behavior, because a lot of the time, especially as adults, we would say, my parents did this, but I understand because they had no choice, or because of their really challenging childhood and all of. I don't need you to justify it, because if you justify it, you cover it. Don't do that. I want you to be as blamey, as shouty, as angry as you can, because we are now going back in touch with your little child that really needed this attention and help and guidance and safety, and you didn't get it. So that's where we're going. So
Amazing.
I always say that, yeah, just go and be as shouty and blamey as you can. Then yes, rip it out. We don't want
And
anyone to.
yeah, and journaling is it's not not everyone has to do it. It is something that can be very powerful. And I just want to put out that when you feel some resistance, sometimes that's the place you need to go. And it's also it's a safe place. It's a loving place. It's a connection to your little child. It's a conversation with yourself.
Mm.
And it's out of your head and on the paper, and that's actually neurological. The other thing is mindfulness, which is like a whole nother year of broadcast that me and you could talk about, because mindful is the key. This is about being aware of your thoughts. They call it, I just learned this word in some of the quantum physics works, which I like to read about, talk about. I think it's called metacognition, where you're watching your thoughts. Now that's meditation. What is meditation? Meditation is just witnessing, watching, observing, recognizing. And I know I'm not the best meditator. It's something I'm going to spend the rest of my life doing that and learning Hebrew. But here's the thing. This I made up. Okay, this one I'll take credit for. We all like control. Everyone does. Who doesn't like control? But there's control, and there's knowing that you're trying to control, and then there's a letting go process. And what is the ultimate form of control? Letting go. When I let go, I'm in control.
Mm.
Isn't that true?
Yeah, well,
Isn't it? Kind of?
well, at least you stop interfering with what is meant for you. That's
Yeah, it's think about it. Letting go is a way that I can control my thoughts, my behavior, acceptance. It's like calming the body down is a letting go. That's you're in your parasympathetic nervous system. All the stuff about the vagal nerve and the vagus and vagal toning. It's beautiful work. It's amazing. It's all about letting go. It's all about flow. And so there's an interesting thing about mindfulness, letting go and watching your thoughts. It's actually a very controlled behavior. And once you learn that, you are flying your plane. You are driving your car. Because we haven't even talked about the Byron Katie work, which is a beautiful set of work about our thoughts are just energy. They come from our unconscious mind. Why would I trust a thought that doesn't serve me? Why would I buy into and lie to myself if that thought doesn't serve me? So there's a whole nother genre here, which is so the meditation, the journaling, it's all kind of tying it together. And meditation, mindfulness, being in the present moment. We haven't even talked about be here now or the power of now. Because when research is when you're in the present moment and you're watching your breath, you're inhaling and exhaling, you're not focusing on your pain. It's impossible to focus on two things. So this is like an incredible trick of the brain. And a lot of people who have healed chronic pain, and some of these Sarno stories, they read the book. What did they do, Einav? They said to their brain, brain, I get you. I get that you're protecting me. You're not punishing me. I get it. I'm giving you the signal to protect me, and you're creating inflammation and muscle tension and drawing blood and oxygen and getting me ready for fight and flight. And I'm sweating, and I must be giving you that message. So this is all part of the understanding, and the mindfulness is such a key. And I think you might, what I think is being a chiropractor and into fitness and rehab is when you're stretching or breathing or moving or exercising, it's a mindful act. It's a somatic act. And when you're aware of that, and you're aware that you might have some discomfort, but you realize it's brain pain, like this becomes part of the next tip is keeping moving. I had a woman on my show who healed herself, it's called Fearless Movement. It's on my broadcast. She's an Israeli woman. She's a movement therapist, lovely woman named Ruth Halperin. She's a doctor. And we have a podcast called Fearless Movement. It's almost like an oxymoron, you know? So what do you think about the whole movement thing and the meditation thing and the somatic thing? How do you feel? Where does that fit into your genre?
Well, I guess I meet people a little bit earlier on because I want to, what I'm saying is that, there is an emotional root cause behind any chronic pain or illness. And I want people to understand the message. And I want them to see that actually they need to start having different conversations with themselves, because when they send this pain messages to the brain, it's just a pattern. It's basically, I'm sitting here, I'm so used to the pain, I'm constantly checking in to see where is the pain, what is the intensity, where is it now in my body, and basically I'm holding my breath. I'm so in the story of pain, and I want to say, actually, let's not do that. Let's find something that is exciting you. What is your 2.0 version? What is exciting in your future? Now let's start looking into that. And by raising your energy because of the excitement and the alignment, you actually move away from the energy of pain. And then you can start doing things that you haven't done for a while.
Beautiful.
So but yes, of course,
Yeah.
movement is important.
And part of the neuroplastic work that I'm trained in, and there's a great movie called Pain Brain. If anybody wants the link, it's like $10. It's an amazing movie about a research about how the brain can change and we can unlearn pain. And it is neuroplasticity, and it is a fascinating work. And part of it is to be with the pain. Like you said, you're so smart to, like, this pain is not dangerous and I can move, and it's just a sensation. If I tapped into my body, I'd find a couple of painful places. I mean, you probably could find it, but we're not fueling it.
Yeah.
So this is the mind. So this is very, beautiful how you brought it up. So there's a few more really quick things. Of course, there's a whole nother thing about accepting that you have a medically unexplained symptom, or, like a diagnosis, and that, how it serves you. Like, this is a whole nother topic, but you have some symptoms, but you have an autoimmune disease, but that you really believe that you can heal yourself. And it's like 1,000%. And that belief goes so far. And if there's doubt, there's a doctor I work with, he's got a program called Crushing Doubt, because for him, the doubts, and it's big. It's big, the doubt. But you can be aware, you can be like, yeah, I have doubt, but it's not causing my brain to protect me. It's a conflict, but I'm aware that I'm in question. So fake it till you make it. Sometimes, sometimes that does work. That's the brain. So believing and owning, and the belief and the hope. Also, gratitude and forgiveness and compassion. Huge chemical changes in the brain. And so much of our suffering because we're angry at somebody or something. And, there's another movie that I promote called Love Heals. And there's a doctor in it, Dr. Fred Luskin, and he has a book called Forgive for Good. And I'm sure we're all understanding what the anger is doing for us. And so this is part of your work, where you get to help people break down and get to that place where that's where they stop growing, at that last angry incident. That's where they're stuck.
Yeah, that's victimhood, and yeah, that's definitely another podcast.
Yeah, yeah.
Dr. Tava, I would like you to tell us maybe one or two success stories that you had
Oh,
with your
God, I
clients.
feel so blessed. I just feel so blessed. That's why, I mean, I'm a little bit of a, what do you call it? Like, you can't tell me you can't. I've seen too much, but not everybody wants to heal. Not everybody wants. It's hard work, and not hard in the word HARD. It's different work. It's counterintuitive. Pain means something's wrong, but not this kind of pain. Symptoms mean I'm sick, not chronic symptoms. The body has learned, and it becomes a habit that I have a mold condition, or that I have allergy, or that I have, a painful joint, or that I have, and osteoarthritis and spinal stenosis and ankylosing spondylitis. They're conditions that can undo, they can heal. You can have a spine where, and I have like at least 4 stories with ankylosing spondylitis, unbelievable stories of people healing this arthritic condition. Um, I met a guy who grew up with horrible eye problems and eye conditions, and he understood it as an adult that it was all stress. And though he has weak things in his eyes, but it doesn't define him anymore. So what happens, Einav, is that people who have these symptoms and these problems, they'll get the symptoms, but they'll understand there's something deeper going on. There's some stressful thing. They'll connect it, and the symptom will go away. Or they don't fight the symptom, and the symptom doesn't bother them. There's a big story about little kids who get hurt, and they wait to see the mother's reaction before they cry. Okay? This is in Dr. Shermaner's story. And there's tons and tons and tons of stories about soldiers who, God forbid, they got injured, but they're happy to go home and they have no pain. I mean, this is pain. Pain is in the brain. Now, acute pain is processed in a different place, but the body heals acute pain. But chronic pain is not normal. It's not normal to feel chronic pain. And majority of chronic pain is neuroplastic. And again, a tumor is a tumor, but people are healing cancer. So this is, and I met this woman who I think you'll have on your show. She's amazing. She had this tumor that wrapped around her heart, and they went in there to do some kind of biopsy, and they couldn't go in through like her cervical artery. And she came out of this little surgery, and they said we had to go in through some other place. And she's like, why? Well, her body created a bypass. Her heart was strangling, the tumor was strangling her heart. She was dying. There was no blood to her brain. The body created a bypass, like road 6, to get blood to her brain. And she's like, I'm going to question this human body. Now, she went ahead and had chemo because she had chemo because her mother made her do it. And she said, I'm going to go into this chemo, and we're going to call it chemo ecstasy. That's Gila, so you see how people get to understand their condition as a test. And a couple other, I've met 4 or 5 people who have literally healed MS and are living. There's a gentleman named Matt Embry. He has a whole website called MS Hope. He's amazing. I have met people who have healed migraines and vertigo, tinnitus, you name it. And yet, let me just say this, and then I'm going to be quiet. It's not about the symptom. It's not about whether I have a story for you. It's about your relationship with your body, because all these symptoms are medically unexplained symptoms. Otherwise, you'd be better from the medicine and you'd be functioning. But if your body's still speaking and screaming, there is a way out. And it's either a stress illness or a medically unexplained symptom. And we are not blaming you. You are a strong and sensitive human being.
Yeah.
You are a special human being, and this is your test. And if you see it that way, then you're not a victim, because it's strong and sensitive people that don't respond to the typical, because there's something deeper going on. You're a deep, beautiful, sensitive person. Sensitive is the new strong. So don't ever feel blame. It's a huge responsibility to take care of yourself. And I think that's what the symptoms are saying. Please take care of me.
I love that.
Yeah.
I love that. And that that really is about being able to pose that conversation, the pattern of the pain, to really say, hang on, there's got to be something beyond that.
Yeah,
What is it? Where do I need to go? How deep do I need to dig?
yeah,
All
yeah.
of that. We nearly, it's time for us to finish. So I just want to really ask, what is one message that you would want to share with our listeners? If there's just one thing that they took away from here
I love
today.
this message, but it's never like I made up some things, but this is not one that I made up. But I love saying that when the student is ready, the teacher will come. And don't ever feel like you need to go through this alone. We're here to guide you and hold your hand, but ultimately the doctor's within you. And when the student is really ready, they don't need a teacher. So we're really here to empower you. And that's why I think I'm attracted to you, Einav, and our work is similar. And it's different in the output, but our purpose and meaning is to empower people and to help them integrate with the medical system. We don't want more conflict in their life. And I think the message is to attract the doctor that will help you, attract the therapist that will guide you, and don't give up on yourself. God gave you a beautiful body, and it heals over and over and over again. And when it's not healing, there's something else going on.
Exactly. And that's thank you so much for being here with us today, and thank you for sharing all your wisdom and insights, and really inspiring us and anyone listening that there is alternatives to healing. There is, just go and find it. Go out there and find your teacher, as you say. Thank you so
Yeah.
much for being here with us today.
All the best. Bye.